Our bodies store fat in two main ways: subcutaneous fat, which lies just beneath the skin, and visceral fat, which resides deep within the abdominal cavity. Subcutaneous fat is the type you can pinch, the kind that sits just under the skin and is often visible around the thighs, hips, and arms. It's the fat that many people are familiar with and often focus on when they think about weight loss or body image. Visceral fat, however, is much more insidious. It wraps around vital organs like the liver, pancreas, and intestines, making it less noticeable but far more dangerous. This type of fat is not just a passive storage of excess calories, it actively influences our body's metabolism and overall health. Surrounding these vital organs, visceral fat can interfere with their normal functions. For instance, it can affect the liver's ability to process insulin, leading to insulin resistance and eventually type 2 diabetes. It can also impact the heart, increasing the risk of cardiovascular diseases. While both types of fat can impact our health, visceral fat, often referred to as active fat, poses a more significant threat. This is because it is metabolically active, releasing various substances that can cause inflammation and other health issues. Unlike subcutaneous fat, which primarily serves as energy storage, visceral fat actively releases inflammatory compounds and hormones that can disrupt normal bodily functions. These substances can lead to chronic inflammation, which is a known risk factor for many serious health conditions, including heart disease, stroke, and certain types of cancer. This hidden danger lurking within our bodies can have far-reaching consequences for our health and well-being. It's not just about the extra weight. It's about the internal havoc that visceral fat can wreak on our organs and systems. Think of subcutaneous fat as a harmless roommate, quietly occupying space. It may not be aesthetically pleasing, but it's relatively benign compared to its counterpart. Visceral fat, on the other hand, is more like a disruptive neighbor, constantly creating havoc and disrupting the peace. It doesn't just sit quietly. It actively interferes with the body's normal functions, making it a much more serious concern. It's not just about aesthetics, it's about the very foundation of our health. Reducing visceral fat requires a comprehensive approach that includes a balanced diet, regular exercise, and lifestyle changes aimed at improving overall health. The accumulation of visceral fat is like a ticking time bomb, silently setting the stage for a host of health issues. If left unchecked, it can lead to severe health problems that can significantly impact the quality and longevity of life. Understanding the distinction between these two types of fat is crucial for recognizing the urgency of addressing visceral fat and its potential impact on our lives. By being aware of the risks, we can take proactive measures to reduce visceral fat and improve our overall health. By acknowledging this hidden danger, we can begin to take proactive steps towards mitigating its risks and reclaiming our health. This involves not just focusing on weight loss, but also on adopting a healthier lifestyle that includes nutritious eating, regular physical activity, and stress management. In doing so, we can reduce the harmful effects of visceral fat and enhance our overall well-being. Visceral fat is a key player in the development of chronic diseases that plague modern society. Unlike subcutaneous fat, which lies just beneath the skin, visceral fat is stored deep within the abdominal cavity, surrounding vital organs like the liver, pancreas, and intestines. This type of fat is particularly dangerous because it is metabolically active, releasing various substances that can negatively impact our health. It acts as a ticking time bomb, silently contributing to a cascade of health issues that often go unnoticed until they escalate into serious medical conditions. The presence of visceral fat is not always obvious, as it can be hidden deep within the body, making it difficult to detect without medical imaging. This silent contributor to health problems can lead to a range of issues, from minor discomforts to life-threatening conditions. People may not realize the extent of the damage being done until they experience symptoms that prompt them to seek medical attention. By then, the situation may have already progressed significantly. The inflammatory compounds and hormones released by visceral fat wreak havoc on our bodies, creating a state of chronic inflammation. This inflammation can damage blood vessels, increase blood pressure, and interfere with the body's ability to regulate blood sugar levels. Over time, these effects can contribute to the development of serious health conditions, increasing the risk of cardiovascular disease, type 2 diabetes, certain cancers, and metabolic syndrome. Visceral fat is a major concern for public health. Cardiovascular disease in particular is a leading cause of death worldwide, and the presence of visceral fat significantly heightens this risk. Visceral fat elevates bad cholesterol, LDL, and triglycerides while lowering good cholesterol, HDL. This imbalance in cholesterol levels can lead to the buildup of plaques in the arteries, increasing the risk of heart disease, stroke, and other cardiovascular events. Managing cholesterol levels is crucial for maintaining heart health. Increasing the risk of heart disease, stroke, and other cardiovascular events, visceral fat's impact on cholesterol levels is just one of the many ways it undermines our health. Regular exercise and a healthy diet can help mitigate these risks, but awareness and early detection are key. It disrupts insulin sensitivity, making it difficult for the body to regulate blood sugar levels. This disruption can lead to insulin resistance, a condition where the body's cells become less responsive to insulin. Over time, insulin resistance can progress to type 2 diabetes, a chronic condition that requires ongoing management leading to insulin resistance and eventually type 2 diabetes. Visceral fat's impact on blood sugar regulation is a significant concern. Type 2 diabetes can lead to a host of complications, including nerve damage, kidney disease, and vision problems. Early intervention and lifestyle changes can help manage and even prevent the progression of this condition. Research links visceral fat to an increased risk of various cancers, including colorectal, breast, and pancreatic cancer. The exact mechanisms are still being studied, but it is believed that the inflammatory environment created by visceral fat may promote the growth and spread of cancer cells. This makes managing visceral fat levels an important aspect of cancer prevention. Visceral fat is a key player in metabolic syndrome, a cluster of conditions like high blood pressure, high blood sugar, and abnormal cholesterol levels that significantly increase the risk of heart disease, stroke, and type 2 diabetes. Metabolic syndrome is a growing concern, and addressing visceral fat is a crucial step in reducing its prevalence. These are just a few examples of the wide-ranging impact of visceral fat on our health. Its effects are far-reaching and can influence nearly every system in the body. From cardiovascular health to metabolic function, the presence of visceral fat can have serious consequences. Its insidious nature lies in its ability to operate behind the scenes, causing damage without immediate symptoms. This makes it a silent threat that can go undetected for years. Regular health checkups and imaging tests can help identify visceral fat and allow for early intervention. Slowly but surely undermining our well-being, visceral fat's impact can be mitigated through lifestyle changes. Regular physical activity, a balanced diet, and maintaining a healthy weight are essential strategies for reducing visceral fat and improving overall health. Awareness and proactive management are key to combating this hidden danger. Visceral fat accumulation is a complex interplay of genetic predisposition and lifestyle factors. Our genes lay the groundwork, influencing our body's tendency to store fat in certain areas, including the abdominal cavity. However, our genes are not our destiny. While we can't change our genetic makeup, we can significantly influence how our genes are expressed through our lifestyle choices. Think of it like this. Our genes provide the blueprint, but our lifestyle choices determine the construction materials and the pace of the build. Unhealthy habits can switch on genes that promote fat storage, particularly in the visceral region. On the other hand, a healthy lifestyle can help keep these genes in check, reducing the likelihood of excessive visceral fat accumulation. Understanding this interplay empowers us to take control of our health. By making conscious choices that support a healthy metabolism, we can influence how our genes express themselves and reduce our risk of accumulating dangerous visceral fat. Section 4. The modern lifestyle trap. Fueling the fire within. Our modern lifestyle, characterized by processed foods, sedentary behavior, and chronic stress, has created a perfect storm for visceral fat accumulation. The standard American diet, often referred to as SAD, is laden with refined carbohydrates, unhealthy fats, and added sugars. This diet provides a constant influx of calories that our bodies often struggle to process efficiently. This excess energy gets stored as fat, particularly in the visceral region. Coupled with a lack of physical activity, our bodies are not burning enough calories to offset the intake, leading to a surplus that further contributes to visceral fat storage. Chronic stress, another hallmark of modern life, exacerbates the situation by triggering the release of cortisol, a hormone that promotes fat storage, especially in the abdominal area. This combination of poor dietary choices, lack of exercise, and chronic stress creates a vicious cycle that perpetuates visceral fat accumulation. Breaking free from this modern lifestyle trap is crucial for preventing and reversing the detrimental effects of visceral fat on our health.
Check. Check 1, check 2, check.
Section 5, a cascade of consequences, the health impacts of excess visceral fat. The consequences of excess visceral fat extend far beyond a larger waistline. This type of fat, which accumulates around the internal organs, is particularly dangerous because it is metabolically active. Unlike subcutaneous fat, which lies just under the skin, visceral fat is deeply embedded and can have a profound impact on your health. This metabolically active fat acts like a toxic factory, releasing inflammatory chemicals and hormones that infiltrate the bloodstream, wreaking havoc on various bodily systems. These chemicals, known as cytokines, can cause inflammation throughout the body, affecting everything from your heart to your liver. Over time, this chronic inflammation sets the stage for a cascade of health problems. Chronic inflammation is a silent killer, often going unnoticed until significant damage has been done. It can lead to a host of issues, including cardiovascular diseases, metabolic disorders, and even certain cancers. The cardiovascular system bears the brunt of this assault. Inflammation and the chemicals released by visceral fat can damage the lining of the arteries, making them more susceptible to plaque buildup and narrowing. This increases the risk of heart attacks and strokes, which are leading causes of death worldwide. Visceral fat increases LDL cholesterol, which is the bad cholesterol, and triglycerides, while decreasing HDL cholesterol, the good cholesterol. This imbalance in cholesterol levels further contributes to the risk of developing cardiovascular diseases. This creates a perfect storm for plaque buildup in arteries, leading to atherosclerosis, heart attack, and stroke. Atherosclerosis is a condition where the arteries become narrowed and hardened due to the buildup of plaque, which can severely restrict blood flow. Furthermore, visceral fat disrupts the body's ability to regulate blood sugar. This disruption can lead to insulin resistance, where the body's cells become less responsive to insulin, a hormone that regulates blood sugar levels. It interferes with insulin sensitivity, leading to insulin resistance, a precursor to type 2 diabetes. Type 2 diabetes is a chronic condition that affects the way the body processes blood sugar and can lead to serious complications if not managed properly. Excess visceral fat also increases the risk of developing certain types of cancer, including colorectal, breast, and pancreatic cancer. The inflammatory environment created by visceral fat can promote the growth and spread of cancer cells. The impact doesn't stop there. Visceral fat is also linked to a range of other health issues that can significantly affect quality of life. Visceral fat is linked to sleep apnea, fatty liver disease, osteoarthritis, and even Alzheimer's disease. Sleep apnea is a condition where breathing repeatedly stops and starts during sleep, leading to poor sleep quality and other health issues. Fatty liver disease occurs when fat builds up in the liver, potentially leading to liver damage. Osteoarthritis is a degenerative joint disease that causes pain and stiffness, while Alzheimer's disease is a progressive neurological disorder that affects memory and cognitive function. Addressing visceral fat is not just about aesthetics, it's about safeguarding our overall health and well-being. By reducing visceral fat through a combination of diet, exercise, and lifestyle changes, we can improve our health outcomes and reduce the risk of these serious health conditions. Taking proactive steps to manage visceral fat can lead to a longer, healthier life.